Attendees are in listen-only mode.
Good morning, everyone. Thank you for joining us. Today is Friday, March 20th, 2015. My name is Andrea Gallagher, and I'm past president of Life Planning Network. We have over 30 professionals from throughout the United States working in a wide variety of life planning areas joining us for today's program. This is our first webinar of 2015, and I'm very much looking forward to hearing from our presenters today speak about ALPA, Advocacy Leadership for Positive Aging. The agenda for our hour together includes 3 minutes of housekeeping from me and an introductory section from past president of LPN and ALPA board liaison Donna Schaefer. Then the program presentation of approximately 40 minutes. The group will be taking questions at the end of the presentation. Our program today is a webinar, meaning that if you're participating by computer, you'll see the welcome slide in front of you right now, the first slide of the PowerPoint deck, with some basic information about today's presentation. This presentation had slides that accompany it, so if you can view it at a computer, you'll find value in the visuals. If not, you're welcome to be with us by phone. We encourage you to visit and explore the LPN website to learn about upcoming programs and local and regional meetings. We especially invite you to consider joining our fast-growing LPN community to receive all the benefits of membership. The recording of today's webinar will be posted in the members section. Everyone is muted because we're recording the program, yet we do encourage and invite your participation. If you are participating by computer, near the bottom of your side panel, you'll see a listing that includes questions. When you click on the little plus sign in front of the word questions, it will open a box where you can type in your question. We will try to get to everyone's questions at the end of the session. If you have further questions after the program ends, I encourage you to reach out to Mary Radu or Jan Hively. Their contact information will come up at the end of the presentation. I will now turn the microphone over to Donna Schaefer, past president of Life Planning Network. Donna?
Thank you, Andrea. And hello, everybody. I'm also very pleased to welcome you to this webinar. We're really glad that you joined us and that you're interested in learning more about ALPA, which is a project of the Life Planning Network. Andrea, can we have the next slide, please? Our presenters today include Jan Hively and Mary Radu, Dorothy Keenan and Eileen Carrasio, and Karen Carney. Sheila Tarbett, who was the evaluator for the first 2 ALPA pilot projects, is also on the call today and will be available if you have questions at the end of the presentation. I also want to mention that Ramsey Alwyn is also on the call. Ramsey is the Vice President for Economic Security at the National Council on Aging, NCOA, and made a significant contribution to the ALPA curriculum regarding economic self-sufficiency. So Ramsey also is available for questions if you have them at the end of the presentation. Lastly, in acknowledging people, I just want to thank Andrea Gallagher, a past president of LPN, whom you've already met. Andrea is managing the presentation logistics for us today, so thanks again, Andrea, for doing that. Could I have the next slide? This slide provides an overview of today's agenda. Jan Hively will be giving lots of background information about ALPA, the opportunity it represents for you, the ALPA story, and a description of the program. Next, we're going to hear from those who have actually implemented the 2 ALPA pilot projects, Dorothy Keenan and Eileen Carrasio at Quantum, and Karen Carney at LifeSpark. Finally, Mary Radu will walk us through various roles and responsibilities of host organizations and program facilitators, information that you will certainly need to have if you're interested in implementing an ALPA project. Then, as we've been mentioning, we'll have an opportunity for any questions that you might have. So we have lots of exciting ground to cover today, and that starts with Jan Hively, who will talk about the opportunity that ALPA represents. The next slide, Andrea, please. So what I want to do now is to introduce her to you, Jan Hively. Jan?
Hi, I hope that you can hear me. Good morning, everyone. This program was developed primarily because we want to reach out to people who are interested in either contacting local service providers or actually thinking about yourself as a discussion facilitator or coordinator of a regional or local program. We feel that we're ready. We've gone through the whole process of piloting the program in 2 different places, and with different hosts. We've revised the whole curriculum actually 11 times so far, and it's ready for rollout. So we want to, first of all, tell you about the opportunity that may provide for you as an individual in your own community. Obviously, it gives you a chance to connect with local service providers who may be useful to you as in the future as other clients for your own business. It gives you the opportunity to establish your own expertise in life planning and self-advocacy. It gives you the opportunity to establish your skills as a group facilitator and a community educator. And of course, it brings positive aging and life planning to a broader segment of your community. Eileen developed the next slide, and it shows people handing off from one to the other. That's what we're doing here. We're handing off. This is a Train the Trainer program. We work with service providers, people who are providing service for older adults, so that they learn about opportunities and they learn about new skills, but they also then can hand it off by empowering the clients that they work for. So for those of us who have worked on developing the curriculum, or for those of us who offer the curriculum, it is a matter of following Gandhi's words, be the change you want to see in the world. This is a legacy program where we can call it Train the Trainer, or we can call it being a role model for what we hope to then use to empower others. What are the big questions? Andrea, would you change the slide, please? I think that the biggest question, I'm now 83 years old, and there are many of in my own generation who grew up as I did with expectations that were relevant when people lived 20 years, fewer years than they live now, and when the whole custom, the traditional custom, was one of expecting dependency in later life. How do we shift from our ingrained expectations for dependency in later life to empower proactive planning for self-determination? What we know now is that 3/4 of the people, once they get to age 60, are probably going to be healthy and active into their mid-80s, and many far beyond that. So how do we encourage people to see the opportunities, yes, and to face the challenges, but to face it themselves? Because what we do know, and I know from my research in productive aging, is that when I ask the question, what means more to you than anything else as you grow into later life, is the ability to make decisions for myself as long as it's possible, to be for self-determination as our primary goal. So the ALPA story began in 2010 at the Positive Aging Conference that was being held then in Los Angeles. And we heard Chuck Yanikowski, one of our LPN members, ask the question, how can we reach older adults who are anxious about economic security, who do not have the money or the contacts to have a life coach that can work with them directly? How do we reach further? And Chuck assembled, probably there were 20 people there who were in the conference calls over the first few months. We had a conference call every month. And then Mary Radu and I took on the task of going from that point to organize a curriculum. We began thinking that we were going to be offering this as a college course or a gerontology course for people who were service providers or graduate students. We thought also about offering it through directly to older adults to help prepare them. But one of the most important problems with that was that in each case we were talking about charging tuition for a course through an educational institution. And we felt very strongly as volunteers in this process that if our goal is to reach out to people who are low and moderate income, then we need to be able to provide an online curriculum that will end up with their receiving that assistance for no cost. So that brought us then to this curriculum that we have been working on now for over the last 4 years. If you could change the slide, please, Andrea. So we have called we've talked about this as being advocacy leadership. And what does that say? Eileen provided this wonderful slide for us. It refers to an individual's ability to effectively communicate, to convey what you have to say, to be able to know what your interests and desires and needs and rights are. You've gone through a process of identification, but then you need to assert your needs, your rights, your interests. You need to be able to negotiate with others. Most of all, it involves making informed decisions and taking responsibility for those decisions. It's part of self-determination. You're not going to be able to make decisions for yourself all your life if you don't have the skills of self-advocacy. And too often we think about leadership, advocacy leadership, as being something that people can show to us, and we follow those people. We're talking about advocacy leadership as a set of skills that are common and should be learned by everyone. I recently had surgery, and I can tell you that I realized very quickly when I was in the hospital when my visitors weren't around, and when that late night nurse came in and started an incorrect procedure, I thought, I've got to come to here and make myself known in many different ways as one grows older. You're facing people with expectations for your abilities, for your capacities that don't fit with your own expectations for yourself. And it's absolutely essential that we learn how to be advocates for ourselves. What is the Advocacy Leadership for Positive Aging program? Andrea, would you change the slide, please? Well, it is a leadership training program for people who are providing services for older adults. That may be paid, or they may be volunteers. They are working with a targeted population, and our first and foremost targeted population are low and moderate income people, but it certainly, as we have just mentioned, applies for all. That all of us as older adults can use the benefits of this program. And it is a train-the-trainer format in that the providers learn for themselves. They take the self-assessments, they think about their own careers, they think about their own future, their own challenges, and they learn life planning skills so that they can then move to changing the lives of their clients and empowering their clients as role models for them. It's been designed by the Life Planning Network, and the program is owned by the Life Planning Network to help people acquire knowledge and skills for self-advocacy and self-management. It is an online curriculum. It's free to anyone, but it is taught as in the local setting, in a learning circle, 15 to 20 people. We like to have up to 20 participants in the circle, led by discussion facilitators. So those the participants go to a folder which is designed for each local host organization. They find their videos and readings. All of the readings are online. We have suggested readings, we have suggested films, but all that is essential for them, as so to speak, homework, is online. They do that between sessions, and when they come to the session, they come with results from the assessment, or they come with results from the interview that they did of an older adult, or they come with opinions about the readings that were done. And they're led through 2.5 hours of discussion of that material. Let's look at the next slide now, which gives us a diagram and shows us how we go around this wheel of learning that constitutes the ALPA program. The first 4 sessions are learning, knowledge building sessions. They are designed to help people assess their own strengths and needs, but also they want to change expectations that were perhaps more negative based upon traditional learning about traditional aging, and think instead of the potential and opportunities of today and what's coming. They understand the challenges, the economic challenges that Ramsey Alwyn knows so well in her role as at National Council on Aging. The first 4 sessions work with that understanding and assessment. Then they move on to try out what they've learned in the field work over the course of a month between the 4th and the 5th session. They find resources. We try to find a mentor for each one, doing an individual plan. They try out their learning, then take action and report. Next slide, please. And this shows the same process in a different way. In sessions 1 through 4, they're sharing and discussing their learning from their assigned readings and the action learning assignments. They're viewing and discussing the videos, which are made as narrated PowerPoint demonstrations from nationwide experts, including Peter Whitehouse, a neuroscientist, Helen Kivnick, a professor of social work who's developed a vital involvement practice program from Ramsey. And in this case, I think Mary and I are calling ourselves experts as well. I'm an expert when it comes to thinking about meaningful work, productive aging, and Mary is certainly an expert when it comes to coaching and thinking about life planning tools. So each one of us has done one of these videos for this work. They also, of course, are developing relationships. They're learning what each other is doing already, and they are talking about what they can do together as a team. And that gets us to these individual field assignments. Each one of them at the end of session 4 has shown a brief description of a field work project, which may be an individual project, or it could be done by team members together. You'll hear examples about both. And they have assistance provided by mentors who work with them on a day-to-day basis. In sessions 5 and 6, they actually are very simple. They are each individual participant is given an opportunity to report on what they've been doing. They may not have completed a project, but they can report on how it's going, what progress they've made, what impact there has been, and what they feel would come next, what they would change. They have group discussion about each one of their fieldwork assignments. At the end of session 6, then, there's a graduation ceremony where each one receives a certificate, which is also found online, and where they talk together about what's next. Ideally, they'll set a time maybe 3 months out when they'll all come together again to update how things are going. But even more ideal would be a long-term networking process. We expect each group, each cohort, each learning circle to really develop working relationships that will continue as they move ahead with their goals. Next slide, please. And finally, my final mention here is the fact that we have taken this program to many people with it as advisors who have reviewed them, the 11 revisions along the way. But we also, and more important, have piloted them in 2 locations, and you're going to be hearing from people who are involved in each one of these pilots. The first pilot that we did was in my hometown, the Twin Cities, Minnesota, Minneapolis and St. Paul, with a wonderful organization, LifeSpark, a home care provider already working on a plan with every client. They are private pay clients receiving home services, and they want to further clarify and strengthen their staff team preparation and practice, and they began the pilot. You'll hear how it went from Karen Carney. The second pilot was very different. It was in Washington, D.C., Maryland, and Northern Virginia, and I think it was either 11 or 13 sites. You'll be hearing about this from Eileen Carrascio and Dorothy Keenan, with a housing management company, Quantum, who wanted a new tool to help housing managers and service providers to address resident needs. And you'll hear more about their residents who are primarily economically disadvantaged, culturally diverse, and often with disabilities. Go to it. I'm going to first introduce Dorothy Keenan and Eileen Carrascio, who will tell you about their perspectives as the coordinators of the Quantum pilot.
Hi, this is Eileen Carrascio, and I'm going to talk about the role as the coordinator and how it works. In our role as coordinator, we acted as the liaison and team builder between the host organization, the participants, and the coaches. This included such logistical activities as answering all those host questions and ensuring that that memo of understanding got signed, program setup, enlisting LPN members to participate as the coaches. We have set aside extensive planning and prep time for each class, with the curriculum guiding that content and process. We created learning objectives and slides to keep us on track. Dot Keenan and I took turns presenting and co-facilitating discussions. We enlisted members from the host organization as well as our LPN coaches to speak on potential focus areas for fieldwork projects. We sent our printing requests to the host before classes. We encouraged and modeled sharing, networking, and community building in all of our contacts with the program. We kept logs of attendance, assignment completion, and performance, as well as project development and progression. As for homework, we prepared our participants for their upcoming assignment in class and sent out reminders. And those homework discussions often resulted in them sharing their work interests and work challenges. These timely discussions allowed us to encourage the participants to connect what they were learning in class and apply that to their work interests and challenges in their practice areas in terms of a field work project. And those field work projects where the participants did apply the whole ALPA process to their advocacy interests and challenges became the most exciting and rewarding part of the program. We provided them with support in terms of organizing templates and outlines for their project proposal, as well as availability for questions. We added in a SMART goal format to allow all of their wonderful ideas to become grounded. We assigned each an LPN coach. We had 14 participants and 11 projects. We made up a grid of all the sites, the participants, the coaches, the projects, and their presentation dates. This kept us easily on track with monitoring progress and accountability. Some of these projects included setting up educational programs in health, finance, and relationships. Another was setting up a money-saving bulk buying program. And several others included creating resources and directories of services. Just so you know that all of these projects with photos can be found on the ALPA website. And then we concluded our program with a wonderful graduation ceremony, and we were most honored to have had Ramsey Alwan, National Council on Aging's Director on the Economic Security Initiative, give the keynote speech and grant certificates. And next up is Dot Keenan. She will describe the valuable impact of ALPA in the outcomes. Dot?
Hi, I'm Dot. I'm planning to talk today about how the individual who took the ALPA course gained an understanding of self-advocacy. I'll also speak about the benefits to the host organization and the benefits to the residents of the housing sites whose service coordinators were the participants of ALPA. Quantum staff reported that they understand their residents' challenges better. They have learned to allow the residents to self-advocate. They have a better understanding of local resources. They have identified local community partners that they can depend on, and they have developed a camaraderie among themselves and their supervisors. Quantum management has benefited as they now have a more cohesive direct service staff who will continue to meet on a quarterly basis and who now have a peer support network. Each participant grew in their knowledge of empowering self and others. Through the exercises and discussion groups, individuals identified their own values and came to see themselves as advocacy leaders. There were many times that the team members showed support and interest in other people's accomplishments, and as a result, we left a more cohesive, cooperative team who were willing to work together in achieving self-advocacy for their residents. For example, several people worked together to develop a resource book of services and programs, which were then available to the residents in our community. The book provides contact names for county, federal government, profit, and nonprofit organizations. They decided to work on this together so that they could have a more complete book. The organization which promoted ALPA in Fairfax was the Long-Term Care Coordinating Council, which consists of leaders of most of the influential nonprofit and service organizations in our county. One of the LPN benefits is that now name recognition amongst these leaders as LPN has become synonymous with ALPA in our Fairfax community. Eileen and I are very proud of the assistance that ALPA received from the CLPN, that's the Chesapeake Life Planning Network's members, who coached and assisted each ALPA resident with their individualized fieldwork project. We're happy to report that ALPA participants enjoyed the fieldwork projects and intend to continue those projects and future endeavors which support their favorite slogan. This is what they felt that most accurately described what they were doing now, and that is nothing about me without me. I'm going to turn it on over to Karen Carney, who's going to be speaking about LifeSpark.
Thanks, Donna. I'm with LifeSpark in Minnesota, and we were thrilled to have been the first pilot site for ALPA. I want to share a little bit about our experience as a host. When I first connected with Mary and Jan to talk about ALPA, we were so excited because ALPA is so in sync with our LifeSpark philosophy. We are described as a home care company, but our model is really a whole person senior care model with a mission to spark lives. And as Jan mentioned, our goal is to have 100% of our clients to have a whole person life plan. So that was really important to us. So as we started to look at how do we bring ALPA into our organization, how do we work with this curriculum, we made the decision to focus on our managers. And actually, because we believe in employees for life, clients for life, and partners for life, we decided to also bring in managers from some of our partner organizations in a curriculum session that would really focus on train the trainer. And we saw a lot of benefits from this. A few of them are, one of the most important was expanding our staff skills. We really found that the ALPA curriculum built a deeper portfolio of skills for our managers to bank on. It was a blend of both the practical and the academic skills. So there was a nice richness there that our staff discovered. In addition, I think one of the biggest pieces, one of the major benefits of hosting the ALPA curriculum was really teamwork. So from the very beginning, we built teamwork into the program, first by starting by inviting in partners who were then working side by side with some of our managers. But in addition, all the projects were done in pairs, so there was a lot of teamwork reinforcement through that method as well. And a number of the projects focused on teamwork as well. In fact, one in particular was with our LifeSpark team member working with an Oak Meadows manager. We actually deliver our LifeSpark services on this senior living campus of Oak Meadows, and we worked together through that project to develop teamwork among our staff so that by having them work closer together and be more collaborative, that then the combined focus could be at looking at how do we then create stronger advocacy for our clients for themselves. And so that was very successful. And I think another aspect of teamwork was right from the very beginning. The members who were participating in the curriculum actually asked the facilitator to spend more time networking. They said the curriculum videos and homework and other materials were really helpful, but they didn't want to focus on that during the actual sessions. During the sessions, they really wanted to be able to learn from one another, to share their experiences and their insights, and so that networking became core to reinforcing, I think, the teamwork that was the major theme and benefit throughout the entire curriculum. Certainly we found the overall experience continued to deepen our LifeSpark differentiation in our market. That focus on client advocacy and what we call sparking lives. And so that was really a good benefit. And I think one of the last benefits was really the creativity that bubbled up from all the participants. As they started to think about things in a different way, it enabled us to help make our existing resources go further in ways maybe we hadn't thought about before. So that was really a wonderful finding that we got from it. Overall, the feedback from the evaluation was just extremely positive. The fieldwork projects, though, I have to say, were the cornerstone and brought everything together. That was the real richness of the curriculum, just as Eileen was mentioning. It really brought all those pieces together into the learning. And there was a lot of learning. As the first pilot site, ALPA was learning, LifeSpark was learning, and certainly all the participants were as well. But as I mentioned, all the evaluations were extremely positive. Just to share a couple with you, one of my colleagues shared that she found that it's not always about me, that when I meet with clients and their families, I'm listening more and asking questions more. Another said, I led a group of seniors with a presentation on Let Your Life Shine. She just found that was so successful because she listened to their stories and heard how they wanted to be helpful and more active. And we've just found that to be so important, that focus on purpose and passion no matter where you are in your life. And so it was great to see some of those things reinforced. All the session scores were really high. They ranged from 4 to 4.8 on a scale of 1.5. And all of our program participants really felt that this curriculum helped them better assist clients to advocate for themselves. And in fact, we did some before and after evaluations, and we found a marked difference in people's feeling of preparedness to be an advocacy leader. So the score beforehand was 7.3. and the score afterwards was 8.6 on a scale of 1 to 10. So those were just some really great findings. You know, we were really pleased that we saw that people were positively feeling about the curriculum. We've really found it beneficial as an organization as well, and we've integrated the learning into our ongoing practice in a couple of ways. The first is we've looked at how we can build in more time for our teams to get together and reflect and share experiences and expertise. That's just one of those things that we didn't always make time for, and now we do. The other is we've integrated several of these tools into our ongoing onboarding for life care managers. Those are our nurses who work closely with our clients and families as their personal advocates. I guess overall I would say as a host, and kind of to share our experience for those of you considering this, is we feel it really strengthened our person-centric approach as a provider, and really appreciated the opportunity to participate and be a host, and it's something I'd highly recommend to any of you who are considering it. I know there'll be some more information on these various projects, the field projects, and also the evaluations at the end of the program today, and also on the Life Planning Network website, the ALPA website. And with that, I'm going to hand it off to Mary Radu, who is one of the program curriculum developers, and she can tell you more about being a host site. Mary?
Thank you, Karen. Next slide, Andrea. As Karen said, I worked with Jan in developing the program and am a co-founder with Jan of the ALPA program. Looking to the future, I'm going to cover some points now until we get to the Q&A section that we believe will be helpful to you in considering bringing ALPA implementations to your local community. The curriculum in the program is very flexible, and it's applicable in many settings for organizations who are serving older adults. What's really important is that as you look for your organizations that where this may be applicable, you consider organizations where the ALPA philosophy fits with the current or future mission and strategy of local organizations, where they're interested in self-advocacy and self-determination of older adults. Kinds of organizations to look for are public agencies like County Human Service, the senior divisions, or the AAA, the Area Agencies on Aging, housing providers that are particularly, could be low-income housing providers or general housing providers, and also consider homeless service providers, because there are many older adults who are among the homeless population in many communities. In-home care organizations, they could be public or private. In our community, the JCC and the Episcopal Home Societies are nonprofit, and there are also for-pay organizations where this would apply. Aging in place organizations like the Villages and NORCs, the naturally occurring retirement communities. Senior service centers, elder advocate organizations, and other umbrella organizations that plan and serve older adults, like the Councils on Aging. Would you like to change the slide? So potential hosts, look for hosts that are looking for an opportunity, and as you discuss this with them, let them know that this really allows them to expand their staff's skills. Many staff are working with older adults and have no or limited training for working with older adults. Many of them have no educational background in working with older adults. The ALPA the program is very much a continual education program that offers a lot of skills and knowledge, particularly for these people as well as for people who have had a background but may not have had education for many years in the information that's been learned since 2000 about the abilities and the strengths of older adults. It's also an opportunity for developing teamwork, as Karen mentioned. It differentiates the service from other competitors in helping show that their approaches really support self-management and self-advocacy. It's also in many of our communities, our agencies are facing an aging population that is growing in numbers, and there are organizations that are recognizing that they must maximize the use of their precious staff and dollar resources for meeting this expanding need. So these are opportunities that ALPA offers to these potential hosts. Next slide, please. So the host responsibilities, as well as ALPA and LPN's responsibilities, are spelled out in Memo of Understanding that is on the ALPA website on the host page. I'm going to just briefly mention a few of these host responsibilities. The host is responsible for, the Memo of Understanding describes the host responsibility for identifying and engaging a facilitator for the training, and also carrying out the coordination function. This can be done by two individuals, separate individuals with different skill sets, or it can be done by a single individual, or as in the case of Eileen and Dot with the Quantum, they shared that responsibility. The host is responsible for providing meeting space, handling the logistics of that space, recruiting their participants. They'll also decide how they'd like to customize the ALPA website page that will be used by their participants. They will accommodate the evaluation process that is used during each of the 6 sessions as well as at the end of the program. They will also be responsible for finding or working in the community to identify outside mentors for the field projects. And as you saw in the Chesapeake Bay area with Quantum, there was a close linkage with LPN for using LPN volunteer resources for this mentorship. There's a small fee that LPN asks for the coordination from the LPN side that is used for working with the host, the evaluation, and the website management. And we also ask that the hosts participate in sharing their experience with future ALPA potential hosts, and be involved in helping us identify enhancements to the program that may be helpful. So it's looking at how can we improve the program for future and also help promote the program. Next slide. LPN's responsibility will be to continue to manage the overall ALPA program and the curriculum. We envision that there will be in the near future an ALPA director and an ALPA training coordinator that will take on the role that Jan and I have handled in the past. The director will oversee the curriculum, handle the marketing, and the fundraising. And the ALPA training coordinator will work with the host organizations in the implementation, helping to orient the facilitators and to address questions as they arise throughout the implementation. We have a contract website manager who oversees the maintenance and upgrades of the website, handles updates of the curriculum, and manages the websites, the web page that will be used for the participants and the coordinators. So that website manager creates a unique web page for the participants of that host that is a secure page that can only be accessed via password. We also, ALPA and LPN, take the responsibility for the evaluation, and Sheila Tarbett, as we mentioned before, has helped us develop an amazing set of evaluation tools. and they include the 6-session evaluations. She compiles the results of each of those evaluations and is involved in helping to report back to the host organization. And then finally, LPN has responsibility for promoting ALPA and extending it out to additional communities. We really want this program to move out across the nation for us to be able to address the needs of a greater number of older adults. Next slide, please. So your ALPA role is really looking to identify organizations and their CEOs and their boards who are strategic thinkers and who have a track record of innovation and see the tsunami of need in their community that involves older adults and the needs of older adults. So we ask that you scan your community for these organizations, that you take the initiative to talk with potential hosts about this ALPA or opportunity and the benefits to your community and to the organization. We have many tools on the website that you can use, and Jan and I and those people who have been involved in our past pilots are available to help as you have these discussions. We have PowerPoint presentations that can be used similar to the one that we're using today. Your role would also be discussing the memo of understanding so that they understand what the host role is and what the LPN responsibilities are. You can refer them to the website where they'll find the online curriculum that they can review, the experience of the past host implementations, and the evaluation results. And there's a photo gallery that has been developed that is very graphic in showing how the ALPA experience has impacted past host organizations. And there's also a list of the pilot projects. The next slide, please. So we welcome you in participating in this ALPA experience with us in taking this wonderful resource into our communities, expanding the impact of LPN on a greater number of older adults and helping us make this a movement that becomes an everyday word, life planning in our communities. So I want you to switch to the next slide, Andrea, and we're going to move this into a Q&A session for the remainder of the session.
Okay. Thank you, Mary. We have a couple of questions right now, so I will start those, but I'd also recommend that if you'd like to ask a question, to please do so by filling in your question under the question section on your right-hand little bar there. Okay, so let's start. Joanne Hadlock had a question. Do leaders meet in person with program participants? Who would like to take that?
Eileen, would you like to answer that? Do you want to repeat?
Yes, hi. It's Eileen, and yes, we did meet in person with our participants. We met 6 times. We also would meet with the host organization with individuals that were in our class. So it was very well coordinated. There was a lot of face-to-face time as well as time after class that we would sometimes debrief different things in the class.
Great. The next question also came from Joanne, and she asked, are all members of the training from the same overarching organization, or may they be from, for instance, different housing management organizations?
I will I'd like to respond to that, if I may. This is Jan. Because Karen LeBlanc is on the phone. She will be the coordinator, and I will be the discussion leader for the next iteration of this program, which will be in Yarmouth on Cape Cod in Massachusetts. We are becoming an age-friendly community in the World Health Organization network. And this is part of the groundwork that we're doing in developing the collaboration of all of the participants who provide services in our area. So Our next program, with the host being the town of Yarmouth, will be public-private nonprofit agencies, organizations, each invited to send a representative to this organization. And that way they can find out what each other is doing, what their different organizations are doing, and begin to develop a network that will then be supportive of 4-H friendly communities. So the answer is no, it doesn't have to be people from the same organization. It could be people from different organizations. You know, that's the main, when we talk about quantum, for example, there were people from different housing sites represented, although from the same organization. A lot of ways to skin a cat.
Thanks, Jan. Okay. Sherry G asks, what is the fee that is paid to LPN?
This is Mary. I'll respond to that. The fee for LPN is what we consider a very small fee. Again, we're making this as affordable as possible. We want this to be used by organizations that may be financially strapped and also understand the value of additional training for their staff. So the fee is a fee to cover an encore person that would be working as the coordinator on the LPN side, who would be providing an overview of the role of the coordinator and facilitator for the host. It would be providing, it would basically be a coach that would work with the facilitator for the host to ensure that they understand the training curriculum, that they understand some of the logistical issues, and can very well support their implementation. The coordinator, the training coordinator from LPN would be available throughout the implementation to address any questions that come up. It will also cover the cost of the evaluation specialist executing the evaluation. So for each session, there's an evaluation instrument that is filled out by each participant and each coordinator or the coordinator. And Sheila Tarbett, she takes all of those responses and brings them together to be able to look at the big picture of what the results are for each session, reports those back to the host as well as to the ALPA management. And at the end of the implementation, there is a final evaluation that's filled out, which is then the results of that are reviewed. And there's a final debrief of the implementation at the end of the 6-session series of both the ALPA staff and the host organization to review what the impact was of the implementation. The last piece of the expense that's covered by this small fee is the website management, and that includes setting up a unique page for the website for the host organization for participants to access the general curriculum plus additional documents that the coordinator for the host believes would be of value in helping the participants understand their unique organization and their unique client needs in that community. That website page also has we have the ability to post photos of staff, bios of the participants, so that they can get to know each other and build a community, build a network amongst the participants. So we're customizing the curriculum and the web page for the participants. We also have materials on the coordinators page that we can update and use the general program. For instance, for each session, there is an agenda that we supply as a generic agenda, and we have the ability for the host to take that, modify it, and then they can post that on the participants' website so that the participants see before the meeting and after the meeting what the agenda was that they'll be addressing.
Thanks, Mary. The next question came from Kay Brown. How many mentors would you need for a group of 20 older adults?
May I respond to that? This is Jan. It all depends upon how many projects they come up with. And also, in some cases, people may, know exactly what they want to do, and they can go ahead with the project without a mentor. I mean, but if there, for example, let's say that 2 or 3 people get together on one project, in that case, there would be one mentor. The mentor's based upon the numbers of projects and also who needs and wants to have a mentor. So it's all negotiable. And the mentor, by the way, can be somebody who is just part of the organization, or it can be somebody, as in the Chesapeake Bay area, who are members of the life planning, other members of the life planning network. There are a number of possibilities. I have done projects like this several times, and what I do is to look for a mentor who knows best the process or function, which is the substance of the fieldwork project. That's what I look for. Somebody who has also some skills as a coach. So it's up to the coordinator and the coordinators to find the right match for the mentors.
Thank you. And the last question I have so far, I think, is from Meg, who asks, how much time did this take for the host? How much time does this take for the host? And how much for the on-site coordinator?
Eileen and Dot, would you be able to respond to that one?
This is Dot, and it's hard to say because we were doing a pilot, and each time Eileen and I made some changes, suggested changes. We worked very closely with Mary and Jan to make this pilot work. I would say there were weeks where we put in 20 hours before the next session, but that would have been between the two of us. The host organization needed very little time. They coordinated getting the room and the copies, and they provided some food. So I would say there was very little time on the part of the host organization. And I also would say that in the future, the amount of time needed for the facilitators will be far less, because the program as it exists right now is ready to use. And it's greatly changed from what we had when we started.
This is Jan, and I think that to generalize, we would probably say that the host's on-site person who is responsible for the arrangements, the printing, the website work, and so forth, would be about 10 hours a week. That's what Karen LeBlanc is being given in my case in Yarmouth. And I'd say that for the people who are the discussion leader, that I would expect to spend about 10 hours a week also, and some of that may be contacting mentors. The first 4 sessions certainly take more time than the last 2 sessions, so but on average that would be about what we'd think about.
This is Eileen. I just wanted to add that Dot and I added an extra hour for the first class, and this was to help with community building. We wanted to really ensure that each person had the opportunity to introduce themselves, talk about what they wanted to get out of the program, what they were willing to give in terms of their energy, and it was a really great foundation to start the program off. So we did add an extra hour, and everybody was very happy with that.
You know, one of the things that I realize, Eileen, is that we have not mentioned the length of the sessions. Each session is 2.5 hours. And so in that case, where that hour was added, it would have been 3.5. But typically the sessions are 2.5 hours long. So and that could be early in the morning, as it was at LifeSpark. It can be late afternoon, as it would be with Yarmouth, or wherever in the day the host decides to have it.
This is Mary. I'd like to add one other point that's slightly off target for the question that was given, but I think it's an important point. The participants, there's an expectation that each participant will spend roughly 2.5 hours in preparation before each session. So they would be reviewing, they would be watching the videos, they would be doing the readings, they would be filling out the assessments and the questionnaires that are part of the curriculum. But there is an expectation that each participant, in addition to the class time, will be putting in personal time to be a part of this program and to make the most use of it.
Okay, we're at the top of the hour here, so unfortunately we're going to have to end this really wonderful webinar. And to our esteemed presenters, I want to thank you for an excellent webinar today. You gave us lots of valuable information, both for ourselves and community organizations we might know. You'll be able to find an audio recording of today's webinar by the end of next week on the LPN website, which is www.lifeplanningnetwork.org, under the Events/Podcast tab. You can also look there for our upcoming programs. Thank you all for joining us in today's program. We look forward to staying in touch with all of you. Thanks.